Today we are going to talk about potassium sparing diuretic. Potassium sparing diuretic, we have the spironolactone. The spironolactone is the aldosterone antagonist. It's a aldosterone antagonist and it is a synthetic steroid. Aldosterone antagonist. It's a potassium sparing diuretic. It's a synthetic steroid and structurally related to the aldosterone. Spironolactone is a synthetic steroid and it is structurally related to the aldosterone, and that's why it is the aldosterone antagonist. So what is the mechanism of action? It will enter into the cell and it binds to the mineralocorticoid receptor. So we can also say that it's a mineralocorticoid antagonist, or we can say that it will enter into the cell, binds to the specific mineralocorticoid receptor, that is the MR, in the cytoplasm of the late distal tubule and the collecting duct. What is the site of action of this potassium sparing diuretic? It will going to bind, it will enter into the cell. First of all, it will enter into the cell and binds to the receptor. Which receptor? Mineralocorticoid receptor. And this mineralocorticoid receptor, what is present in the cytoplasm of late distal tubule and collecting duct. Okay. Now there is a formation of hormone receptor complex. Hormone receptor complex, that is the mineralocorticoid receptor and aldosterone. So hormone receptor complex, where it enter into the cell nucleus, and when it enter into the cell nucleus, it induces the synthesis of aldosterone induced proteins, AIPs. There is a synthesis of aldosterone induced proteins. So the net effect of aldosterone induced proteins is to retain the sodium and excrete potassium. What is the net effect of aldosterone induced proteins? The net effect of aldosterone induced proteins is to retain sodium and excrete potassium. But spironolactone, what does it do? Spironolactone competitively inhibits or competitively blocks the mineralocorticoid receptor, which prevent the formation of these aldosterone induced proteins. And if they prevent the formation of aldosterone induced proteins, so what they will do? They promote sodium excretion and potassium retention. That's why it is called as the potassium sparing diuretic. Potassium sparing diuretic, or it can cause hyperkalemia as a side effect, because it will retain the potassium. It will excrete the sodium, it will retain the potassium, it will spare the potassium. That's why the name is potassium sparing diuretic. Potassium sparing diuretic. And this spironolactone is most effective when the circulating aldosterone levels are very high. Circulating aldosterone levels are very high, then it is most effective. It also increases the calcium excretion. It is administered orally. It will get partly absorbed and highly bound to the plasma proteins, extensively metabolized in the liver, and there is a formation of active metabolite, that is the candrenon, which has a longer plasma half-life. Now where we can use this spironolactone? Spironolactone, they are used in the edematous condition. Which is associated with the secondary hyperaldosteronism like CCF, hepatic cirrhotic ascites or nephrotic syndrome. In the ascites, cirrhotic ascites, nephrotic syndrome, or in CCF, in edematous condition which is associated with the secondary hyperaldosteronism. Secondary hyperaldosteronism like congestive cardiac failure, cirrhotic ascites, nephrotic syndrome. Then in case of CCF, spironolactone is often used in moderate to severe heart failure because it blocks the effects of aldosterone. Means it prevents hypokalemia, it prevents ventricular remodeling and retards the progression of disease. Or it reverses the ventricular remodeling, or it retards the progression of the disease. In case of hypertension, spironolactone is often used with the thiazide or loop diuretics, serum potassium level is maintained and the antihypertensive efficacy is enhanced. Then in also used in the resistant hypertension due to primary hyperaldosteronism, that is simply called as the Conn syndrome, in which there is an increased level of aldosterone. Primary hyperaldosteronism, it is also called as the resistant hypertension. In that you can simply go for the spironolactones. Spironolactone, most of the diuretics acts from the luminal side of the membrane. In the nephron, there are two sides, luminal side and basolateral membrane side. But the speciality about the spironolactone is it will going to act from the basolateral side of the membrane, not from the luminal side of the membrane. Okay. Other diuretics like thiazide diuretics, loop diuretics, carbonic anhydrase inhibitors, or epithelial sodium channel blockers like amiloride, triamterene, they secreted in the proximal tubule through organic anion transporter or organic cation transporter. Osmotic diuretic reaches to the lumen of proximal tubule via glomerular filtrate. But the spironolactone acts from basolateral side of membrane. They acts from the basolateral side of membrane, not from the luminal side of membrane. So please remember that. Now what is the adverse effects of spironolactone? It causes hyperkalemia, which is a major adverse effect of aldosterone antagonist. The risk is greater in patients with renal disease or in those who are receiving ACE inhibitors or ARBs. Then other side effects like nausea, vomiting, diarrhea, peptic ulcer, drowsiness, mental confusion. Then it also causes menstrual disturbances or irregularities in the menses. It can cause gynecomastia, decreased libido because of its anti-androgenic effect. And the drug interaction, when it is given along with the ACE inhibitors, it can cause dangerous hyperkalemia. Hyperkalemia when it is given along with the ACE inhibitors. Spironolactone are contraindicated along with the spironolactone because it can cause dangerous hyperkalemia.